We're going to be going over peak flow meters. This is the TrueZone peak flow meter. There are multiple different kinds out there. This is just one of them that you may see, but they all work in the same capacity, work in the same method. What you want the patient to do is to take a big breath in, and then they exhale as hard and as fast as they can. And it's not a long blowout, it's just an immediate explosion to see how open their airways are. Many patients with asthma or different breathing disorders will use these things, will use these devices on a 1 to 2 to 3 times a day, depending on how they're feeling. If they're starting to feel a little tight, they may use it. And what they do is they find their normals. You can see the colors on here, and I'll go through that right now. This is the actual device. It will be packaged in plastic. I've already taken mine out. And you see there's no colors on here. Then you have the directions that are inside, and also the red, green, and yellow. Basically stoplights. If it's green, it's good. You see the yellow. If it's in yellow, use caution. Lower yellow, you really need to use caution. We'll go over this in pulmonary disease. And then the red is your danger. You need to get help immediately. So the green would be that you're good. Yellow, hey, you may need to use your rescue inhaler. Lower yellow, the low end of caution. You really need to watch it. Use your rescue inhaler. Red, use your inhaler. Get to the hospital. Get to the doctor. Get some help because your lungs are shutting down. Remember, the bigger the tube, the better the flow. The same thing with our lungs. If the patient is having a bronchoconstriction, or the bronchoconstriction where the airways are tightening down, you cannot get as much flow coming through. I believe that was Purcell's law, wasn't it? But anyway, so if the area is closing down, then you can't get as much flow. So if you don't get as much flow, then your peak flow will be lower. You also have the instruction manuals in here. You have what you can get the predicted patient's normal for normal male, normal female, normal children. These are the normals, and you go off the height. It's much in the same way that you used with the IS. So on this page, you can find the predicted normals. Now the other thing with a person with a condition such as asthma, they have to find their normal. This will be from doing multiple tests, multiple days. They don't have normal lungs. If a patient has cystic fibrosis, they don't have normal lungs. So we always encourage patients to keep a journal. On the back, in the backpack here, there's also a place for a log. So they could do this over multiple weeks, and then they find their new normal. And then calculate out the reds, the greens, and the yellows. And then they put the sticker on the peak flow so they can read. There's a little marker in here that when you blow, it comes up. And as that comes up, they don't have to really remember the numbers. They put the sticker on where it should be. If it's in the red, etc. You get the point. Okay, so how you have the patient do this? You have it. They take a big breath in and explode out. Again, this is one of the bedside testing techniques that you can test for bronchoconstriction. You may have a pre and post peak flow meter with patients with asthma that you're delivering treatments to see if the treatments actually work. There are better tests, but this is a good, inexpensive test, and also you're teaching the patients on how to monitor themselves. So big breath in. Okay. If you look here, I blew right about 800 liters per minute. Now, that's great. How do you reset it? It's just a shake. See, first shake, it's going down. You can also, I find that method works better, but just don't throw it across the room. So again, typically you'll do 3 peak flows. Right about 800. It may take a few shakes to get it down. See, it's back down at the bottom, the yellow marker. One more time. 800. There, got it back down. Now, you're going to be practicing this in the lab. We don't have 20 or 30 peak flows to go around, so there's a way that we have to adapt it. Because you will be using your filters. If you have misplaced your filter, please bring your filters to every lab. If you have misplaced your filter, then please let me know. You need to hold on to these for the entire semester. Just like we did for the incentive spirometer, I will have a 6-inch piece of corrugated tubing and an adapter. We'll take it, and this will be set up for you so you can practice your peak flows. And we'll put that on nice and tight, and then the filter will just go on this side. It'll get you the idea on how to do this, and we can use these between multiple patients, multiple students. Okay, big breath. As you can see, I get a little bit of resistance due to the filter. Okay, that really did knock it down about 150 cc's. Now, am I worried about this? No, because I would not use this with a patient. I would not use this with a patient because every patient gets their own peak flow meter. They are disposable. They go home with the patient. But for the purposes of lab, we will be using them. There it goes, back down. One more time. See, I'm getting a lot of resistance, but I'm still blowing at 600. Okay, so we take it out, shake it down, good to go for the next. Now with this one, a normal adult should be able to blow about 350 to 600 liters per minute. If you get down below 75 to 100 liters per minute, that is very critical. So we'll go over the percentages. The main thing I wanted you to know about this is how to do the procedure. Full deep inhalation, patient puts it in their mouth, explode out as hard, as fast as they can. It does not have to be a long blow, just a short blast.